Hi Carly, my name is Ariel and I'm one of the nurses here at the OBGYN clinic, and your physician wants me to go over spermicides and barrier methods with you to help prevent pregnancy. So I'll go over each method first and then you'll decide which option is best for you. So let's start with spermicides. These are chemical barriers against sperm. It's actually going to stop the sperm from moving into the cervix and the vagina. So it can come in a foam, gel, cream, tablet, suppository, or film, and it's inserted into the vagina so that it touches the cervix. And then it should be inserted for at least 15 minutes before sexual intercourse, but no longer than 1 hour before starting it. Now, if you decide to have sexual intercourse more than one day, you always want to reapply the spermicide. And then the second one we'll talk about are condoms. So there's a male version and then there's also a female version. So let's start with the male version. It's pretty thin, it's stretchable, and covers the erect penis. It can come in either latex rubber or polyurethane, which is a stronger, thin plastic, or it can be made out of animal tissue. These are safe. There are no side effects. However, it can break or tear during sexual intercourse. And it is also effective against sexual transmitted infections, but just make sure that you check the expiration date because you don't want to use one that's past that date. So the way to put this on is that once the penis is erect, you're going to place the condom on top, which is the head of the penis, and then you're going to roll it all the way down towards the base, and then there's going to be a little bit of space at the top at the tip, and that's going to catch the semen. Make sure that whenever you use male condoms or you and your partner use male condoms that you throw away each one so they're single use only. Now for the female condom, it's similar where it's made of plastic, but then this one has two rings on each side. One end is covered and it's the closed end that's going to go into the vagina. It's going to touch the cervix, and then the open side is going to cover the labia, which is the lips of the vagina. So that's on the external part. You're only going to wear one of them. So either the male or the female condom, you don't want to wear both at the same time because it can increase the chance of a tear, and then of course maybe possibly leading to pregnancy because of all that friction that's going on between both condoms. You can also use an oil or water-based lubricant to help with the noise that comes when having sexual intercourse with the female condom. And then these are sold over the counter, so both types are both sold over the counter. And however, the female condom is only available in one size, and just like the male condom, it's only for single use only. So throw it right after you use it. Now, a third type are called diaphragms. These are specifically a dome-shaped latex or silicone, and there's a flexible rim on the edge of it, and that's going to cover the cervix. These ones come in different sizes, and we want you to wear one that's large enough, but there's no discomfort so that you are not aware that it's actually inside of you. So we want you to be correctly fitted, so we're going to have your physician pick the size. It's going to be replaced every 2 years or if there's any changes to your weight. Now I'll go over the specific instructions with diaphragms, and that first you want to inspect it. So you want to make sure there's no holes in it. So you want to stretch it out, or not, you don't want to stretch it out. You're going to hold it against a light source and just carefully look around, stretch it to make sure that the rim, there's no holes around it, and then just make sure that you don't have sharp fingernails because that can actually poke a hole into the diaphragm. And then another way to check for any holes is if you fill the diaphragm with water, you'll see if there's any water leaking out. Now to actually put it in, you want to first remove the cornstarch that's coating the diaphragm. You want to use a lubricant that's spermicidal, and you want to make sure that you pee first. So you want to empty out your bladder. Then a cream or contraception jelly is going to be placed and coated over the diaphragm. It helps provide the seal on both sides. When you actually put it in, you're either going to squat, have one leg propped up, kind of like you're shaving your legs, or you're going to sit forward at the front edge of a chair, or you can put it in while lying down. So you're going to hold the diaphragm, you're going on the outer rim, and then you're going to compress it. So you want to squeeze it, and then you're going to use your other hand to open the labia. So you want to spread the lips of vagina, and then you're going to insert it as far as it'll go. Once it's inside, you're going to tuck the front rim of the diaphragm behind the pubic bone, which is the pelvis bone on the belly side, so it's the top part. And you just want to make sure that there's a firm suction there. You're going to use your pointer finger to feel around to make sure it's in the right spot and that the cervix is covered. To remove it, you're still going to use your pointer finger. You're going to insert it through at the top part, and then you're going to hook it, and then you're going to turn and break that suction, and you're going to pull it down and out. Now, once it's been removed, you want to wash it in warm water and use soap. Dry it with a towel, and then you're going to dust cornstarch all over it and put it back into its plastic case. So with these, you're going to also use a spermicide, and you want to make sure you empty the bladder, so you're going to want to pee before putting it in and after you have sexual intercourse. Now, there are disadvantages to it. If you feel like removing it and inserting it is going to pose a challenge, if you've had any irritation with spermicides, if you've had reoccurring urinary tract infections or UTIs, or if the vagina has poor muscular tone, so it's not strong enough to hold it in. It can also cause toxic shock syndrome, so we want to make sure that it's removed after 6 to 8 hours after sexual intercourse, and we don't want to use it during when we have our period. Now, another type is called a cervical cap, also known as a fem cap. This is made out of silicone rubber, and it comes in 3 specific sizes. It does fit snugly in the base of the cervix, just like the diaphragm, and it's kept in for at a minimum of 6 hours, but no longer than 48 hours. So this one's advantage to it is that it can be worn for an extended wear. There's extended wear to it. The seal provides a physical barrier for that sperm coming in. For this one, you're also going to use a spermicide, and you're going to insert it the same way as a diaphragm, and it also needs to be, your physician is going to find the correct size for you. The size is checked every year, and some of the disadvantages of it is that it also can cause toxic shock syndrome. It's not good for patients who've had an abnormal result of their pap smear in the past. If it doesn't fit, if there's a history of toxic shock syndrome, if putting it in and removing it poses a challenge, if there's a vaginal or cervical infection going on, or if there's an allergy to the latex or spermicide. Now, the last one that I want to go over as an option are sponges. So these are small and round, and it has spermicide on it already, and it comes in one size, and it fits right over the cervix. There's a loop on it, so you can move it or remove it easily. It does provide protection for 24 hours, and you can leave it in if you're going to have multiple acts of sexual intercourse throughout the day. Just remember to take it out after 24 hours. So to use it, you're going to moisten it with water and then leave it in for a minimum of 6 hours after the last time you have sex. And again, you just don't want to wear it for more than 24 hours because it can increase the risk of toxic shock syndrome. So I'll give you a moment to go over the options, and then you just let me know which one you would like to move forward with. All right, Carly, so you want to go with the diaphragm? Okay, great. So this is a good option for you because you're not allergic to latex. You have used spermicides previously, and you don't have any irritations with it in the past or any side effects. And you don't have a history of recurring urinary tract infections. From your physician, it's been stated that you have good muscular strength in the vagina to hold it in. And then you've also stated that you don't have any issues with the care for the diaphragm, such as washing it with warm water, drying it, and putting cornstarch on it. Okay, awesome. I'll let your doctor know, and we'll be back in one moment. Thank you.